For a lot of people who've tried everything else, it's the thing that finally moves the needle. And then the type that I use, it's got a 75% success rate. So it's pretty good. Are you always on edge or stuck in survival mode? Do you get derailed by your moods? Do you have symptoms that no one has been able to successfully treat? If you are ready to heal naturally and feel calm and in control, check out Root to Recovery. Each week, we explore integrative trauma healing and share practical healing tips. Now, here's your host, Laura Giles. Hey, if you are listening to this episode, I'm going to guess a few things about you. You probably tried therapy, maybe more than one therapist. You might have tried medication or a few different ones. You read the books, you done the breathing exercise. Maybe you've cut out caffeine, started exercising, tried meditation apps, journaling, supplements, all of it. And some of it helped a little, but some still off. You still feel wired for no reason or foggy or like your brain just won't cooperate with you, even if you're doing everything quote unquote right. If that's you, you're not out of options. Today we're talking about something that doesn't get talked about like ever, hardly. I never hear about it. And that's neurofeedback. It's not a miracle cure, and I want to be honest about that up front. But for a lot of people who've tried everything else, it's the thing that finally moves the needle. And then the type that I use, it's got a 75% success rate. So it's pretty good. Let's get into it. So, welcome back to the show. I'm Laura Giles, and today's episode is for anyone who's ever felt like their brain is working against them instead of for them, or maybe not even working at all. So, we're going to cover 4 things: what neurofeedback actually is, why it works based on how your brain actually learns, the different types out there because it's not a one size fits all thing, and who tends to benefit most, and just as importantly, who probably shouldn't even bother. So, this episode is specifically for people dealing with trauma, ADHD, anxiety, or even physical things like eye hand coordination and focus under pressure. The folks who have done quote unquote all the right things and are still asking, so why do I feel like this? So let's start with the basics. So the simplest way that I can explain what neurofeedback is your brain runs on electrical activity. Every thought, every feeling, every moment of focus or panic or calm, it's all electrical signals moving through your brain in patterns. Scientists can measure these patterns using something called an EEG, which stands for electroencephalogram. Don't worry about it. It's just a big word. So just think of it as a way to listen in on your brain's electricity. And neurofeedback takes that idea and turns it into kind of a training tool. So here's what a session actually looks like. You sit in a comfortable chair. A technician places a few sensors on your scalp. So nothing goes into your skin. There's no pain. There's no injection. There's no zapping you. And these sensors just read your brain activity the same way a heart rate monitor reads your pulse. Then you watch something, usually a video or a simple game, or sometimes just changing sounds or images. And here's the key part: that video or game responds to your brain activity in real time. If your brain drifts into a pattern that's connected to feeling scattered or anxious or shut down, the screen might go dim or the sound might get quieter. When your brain shifts into a steadier, calmer, more focused pattern, the video brightens or the sound comes back on, the game moves forward, almost like a reward. You're not doing anything on purpose. You're not trying to think calm thoughts. Your brain is just getting instant feedback over and over, hundreds of times a session, about which patterns lead to reward and which ones don't. So think of it like a mirror for your brain. You can't change something you can't see. And neurofeedback lets your brain finally see itself. And this is the important part. Brains are really, really good at learning when they get clear, immediate feedback. So why would just watching your brain change anything? This comes down to something called neuroplasticity, which is just a fancy way of saying that your brain can change and rewire itself throughout your entire lifetime. It's not fixed. It's not stuck the way you might feel stuck. So here's an analogy that I like. Think about learning to ride a bike. Nobody explains the physics of balance to you. Your body just got the feedback. So wobble, correct, until it learned the pattern. Eventually, you didn't have to think about it at all. You just ride a bike. It's automatic. And neurofeedback works the same way, except it's training your brain's electrical patterns instead of your leg muscles. For someone with trauma, the nervous system often gets stuck in a pattern of high alert, even when there's no danger anymore. That's not a character flaw. That's a brain that learned for good reason at the time to stay on guard. And neurofeedback can help that same brain practice over and over what it feels like to come out of that state and feel alert and calm until that calmer state starts to feel more familiar and more automatic. That's basically the gist of it. So, for someone with ADHD, certain brain wave patterns linked to attention and impulse control tend to look different than a brain without ADHD. Neurofeedback gives the brain a chance to practice shifting into more focused patterns with immediate feedback every time it happens. For eye hand coordination, some approaches focus on brain regions involved in timing, blood flow, and motor planning, helping athletes or anyone recovering from an injury sharpen the split second communication between seeing and doing. Really great for someone who's had a stroke, right? And I want to be honest with you here because this podcast isn't about hype. The research on neurofeedback is still growing. Some uses have stronger evidence than others, and results vary from person to person. So it's not a magic switch, but the core idea that the brain can learn new patterns when it gets clear feedback is well established. Neurofeedback is one way of putting that idea into practice. Now, there's something a lot of people don't realize. Neurofeedback isn't just one thing. There are several different approaches, and the right one depends on what you're dealing with. Traditional EEG neurofeedback, that's the classic. That's the most common form. So sensors read brainwave activity at the surface of the scalp, and training targets specific patterns, like helping an overactive brain slow down or helping a sluggish brain speed up. Loretta, Loreta neurofeedback. This one goes a little deeper, literally. Instead of just reading surface activity, it estimates what's happening in deeper brain structures, and it's sometimes used for more complex emotional or attention related patterns. ILF is infra low frequency training. This is a gentler approach that trains very slow brainwave frequencies. It's used often for trauma, anxiety, and nervous system regulation because it tends to be subtle rather than intense. HEG, or hemaencephalography, this one's different. It doesn't measure electricity activity at all. Instead, it tracks a blood flow to a specific part of the brain. And this one's used often for focus, migraines, and mental fatigue. Live Z-score training. This approach compares your brain activity in real time to a large database of healthy brain patterns and gives feedback aimed at nudging your brain closer to that average. Lens, or low energy neurofeedback system. This one works a little differently from the others. So instead of watching a screen or playing a game, you just sit back and relax. This is a type that I use, and I like it because you don't have to do anything. And it's super quick. Sensors read your brain activity, and a very tiny, gentle electromagnetic signal is reflected back. So mild that people don't even feel anything at all. And because it takes less active effort on your part, some providers use Lens with people who are very anxious, very sensitive to stimulation, or just worn out from years of trying hard to get better. Sessions also tend to be shorter than other types. So you don't need to memorize all this. The takeaway is simple. Neurofeedback is a category, not a single method. A good provider will match the type of training to what you're actually struggling with. So let's look at who this tends to help, especially the people that this episode is really for. If you're dealing with trauma or PTSD or complex PTSD, including the kind that doesn't come from one big obvious event, but years of stress, inability, or feeling unsafe, neurofeedback can help a nervous system that's stuck in fight or flight start to practice feeling safe again. If you have ADHD, whether you're diagnosed as a kid or you're just now realizing as an adult that this explains a lot, neurofeedback can support focus and impulse control, often alongside other strategies you're already using. If you struggle with anxiety or sleep issues that haven't fully responded to therapy or medication, this can be another tool, not a replacement, but an addition. If you are an athlete, a musician, a surgeon, or anyone who depends on eye-hand coordination and split-second timing, some people use neurofeedback and HEG training to sharpen that mind-body connection. Neurofeedback works by optimizing the brain. The brain controls everything. So most things can be optimized by neurofeedback. Just ask to find out. And if you're the person who's tried everything, multiple therapists, multiple medications, all the books, all the apps, and you're still asking, why do I still feel like this? You're exactly who this field is for. Neurofeedback doesn't replace what you've already done, it works alongside it, targeting the brain directly instead of just the thoughts or behaviors on top of it. Now, let's talk about who this is not for, because I'm not here to sell you anything. It's just information. So if you're looking for a one and done fix, this probably isn't it. Neurofeedback usually takes a series of sessions, often weekly, over a few months before people notice lasting change. If you need something to work in one sitting, this is not going to be it. It's going to feel disappointing. If you have a seizure disorder or another serious neurological condition, you should only try neurofeedback under close supervision from a doctor who knows your full medical history. If you can't find a provider who is properly trained, be cautious. This is a field where technique and experience really matter, and quality varies a lot from provider to provider. And if you're hoping this replaces medication or therapy without talking to your doctor first, don't do that. Neurofeedback works best as part of a big picture, not as a substitute for medical care. Now, that said, with LENS, people absolutely do get off their medication. And you do need somebody monitoring your situation, because sometimes positive responses can look like side effects, and they're not side effects. They're side effects of being over medicated. So your medication has to come down so that you get the full benefit of it. That's why you want to work with your prescriber. It's also okay if you try it and it's just not for you. Not every brain responds the same way to every approach, and that doesn't mean something's wrong with you. I don't know about all types of neurofeedback, but I do know with LENS, you don't have to invest a big bunch of time or money to know if it'll work. You either have a positive shift pretty quickly or you won't. You won't be cured quickly, but you'll get some feedback about whether it's working or not pretty quickly. If you're thinking about trying this, here's what the process usually looks like. So you typically start with an assessment, sometimes called a brain map, to understand your specific patterns. Well, actually, before that, you're going to have an assessment to see if you're even suitable for neurofeedback. Then you do the brain map. So from there, a provider builds a training plan around your goals, whether that's trauma recovery, focus, sleep, or something else. And sessions are usually 30 to 60 minutes, and most people do somewhere between 20 to 40 sessions over a few months. Depends on what the problem is. It varies a lot depending on the goal and actually your self-care. If you have good self-care, if you're sleeping regularly, if you eat fresh, alive foods, it's going to matter a lot too. You'll get better faster. When you're looking for a provider, look for credentials from recognized neurofeedback certification boards. It takes a lot of training to do this. Don't be afraid to ask questions about their training and experience, and always loop in your doctor or therapist if you're not working with your therapist. The best outcomes usually come from neurofeedback working with your existing care, not around it or solo. So here's what I want you to take away from today. If you tried everything, you're still struggling, that doesn't mean you're doing something wrong. It just might mean that you haven't found the right tool yet. And neurofeedback isn't magic. It isn't for everyone, but a lot of people who felt stuck find that it's the thing that finally makes their brain learn a new way of being. So this isn't about fixing yourself. You aren't broken. It's just about giving your brain new options, new patterns. If this episode helps you, please share it with someone who's been searching for answers too, and follow up with the information so it's not just information in your head, but it helps you to have a different kind of life. And if you have questions, send them in. I might answer them on a future episode. So thanks for listening, and I'll talk to you next time.